everyone for joining us. I'm Ryan Spiteri, the Communications Manager here at the Brant County Health Unit. Here with me I have Dr. Comley, Acting Medical Officer at BCHU, and Dr. Ann Tober, BCHU CEO. Before we get started, can we do a quick roll call for those joining us? I'll just have you state your name and your affiliation.
Patty Berardi, Rogers TV.
Susan Gamble from the Expositor.
Thank you. In a moment, I'll turn it over to Dr. Comley to make a brief statement. This will be followed by a question and answer period where questions regarding COVID-19 case trends, case and contact management, etc. can be directed at Dr. Comley, and questions regarding vaccines can be directed at Joanne. At this point, if you could put your phone on mute if you're able to, we'd appreciate it, and I'll now turn it over to Dr. Comley.
Thank you all for joining us. I'd like to start by sending my sincere condolences to the family and loved ones of the individuals we've lost recently to COVID-19. Last week, there were 56 cases of COVID-19 locally. We continue to see a rise in deaths related to those who have had COVID-19 infection. This has sadly followed the same pattern we've seen in previous waves. Case numbers rise, followed by a surge in hospitalizations, and then thereafter we see an increase in COVID-19 related deaths. The best tool we have to prevent severe outcomes related to COVID-19 is to receive a vaccine. We continue to see data that shows that COVID-19 vaccines are incredibly effective at preventing hospitalizations and deaths. As of Sunday, 79% of Brant residents 12 years of age and older have received at least one dose of COVID-19 vaccine, and 73% have completed the series. Last week, we saw a large jump in coverage rates for the 12 to 17-year-old residents. There was a 4% jump in this age bracket, and 76% have now received at least one dose. We continue to operate walk-in clinics at a variety of different locations across Brant. Our walk-in pop-up clinic can be found on our website. Beginning tomorrow, the province's proof of vaccination program will come into effect. This means residents must be fully vaccinated and provide proof of vaccination to access certain indoor businesses and settings. Our hope is that this program will continue to encourage those who have not yet done so to receive their vaccination, along with making things safer at these settings for those who have already been vaccinated. I'd also like to take this opportunity to formally say hello to our residents and media present today. As I've worked in the community previously at Brantford General Hospital, I am keenly aware of the fantastic efforts our predecessors and at the Brant County Health Unit as a collective have guided us through this pandemic. I'm really excited to continue down the path that Dr. Abanki and Dr. Law have tirelessly set for our community, and we need to continue to stay the course and take care of one another. We have all been through a lot over the last 18 plus months, and we have sacrificed so much, but these sacrifices have gone a long way to keep the safety of those around us.
Hi there, Dr. Conley. It's Susan Gamble from the Expositor. Welcome to you as well.
Thank you.
I think that a lot of people would like to know, and I'm not sure whether you or Joanne could answer this, but we have had a long run of acting medical officers of health. Can anybody tell us why we don't have just a plain old MOH?
Certainly, Susan. It's Joanne. I can answer that. There is a process where we have to apply to the ministry for our medical officers of health to be duly appointed. So the Board of Health can appoint an acting medical officer of health, and then the application goes into the ministry. And the ministry has taken a long time to process some of those applications. So we were expecting Dr. Abanki to be announced as our full medical officer of health, but that appointment just didn't come through before her departure. And Dr. Locke was just back as an interim, so he was back in an acting capacity as well because he was temporary. And our plan is to have Dr. Comley here as our fully appointed medical officer of health as soon as the provincial processes have been completed.
Excellent, thank you. Also, Dr. Comley, you've been an ER doc here for a long time, and I just wondered, what has your work in the emergency room taught you about COVID that maybe you bring to the table as an administrator and somebody, working in this MOH position now?
I think that there needs to be some great partnerships between the healthcare system and the public health system to ensure seamless communication between the two. And I think the public health unit's been doing a very good job of getting communications to the hospital. I also think that I'm well aware of the fatigue that the healthcare system is experiencing right now because we've been through a lot in the last 18 months, and I think people are really feeling that at the moment. And so we really need to support each other through this next portion of the COVID experience.
If I can just ask to take you back to the local deaths lately, you mentioned that there's been a huge increase, but you compared it to other waves. This seems like we have had more deaths in a compacted period of time than any time in the last 18 months. Is there any reason why this particular time is worse? Because our cases have not shot through the roof the way they have in the past.
Yeah, I think we need to consider that Delta does change the dynamic a little bit, so we might see a different rise and fall than we expected or that we've seen in previous waves. We're seeing some of the similarities in the waves that have occurred in the past. We are seeing an up and a decrease as well. I think it may be a little too early to say or to make a call on that.
And you talked about the first doses increasing. Have you got any numbers about how many people are getting their first doses?
Yes, we're still having a little less than 50% of the people coming into our clinics are for first doses. So that is very positive that we are seeing people coming in. And I think that's probably an indication of the impact of the certificate program. So people are now getting immunized so that they can access certain services in the community as of tomorrow.
Super. And my final question would be, do you anticipate any problems with the proof of vaccine program? I can imagine that there are some people that are worried about it, how it's going to be policed, whether people are going to be angry at them because they have to be the ones to tell them, you can't come in. What is the health unit doing to kind of prepare for this, or what kind of problems do you foresee?
Yeah, at this point, we aren't foreseeing difficulties with the implementation of the program. There's been a lot of information on the media. There's been a lot of information going out to workplaces. We do expect that there will be some hiccups and some people who won't realize that they do certain settings, but we expect that will be ironing itself out very quickly, and by far the majority of the population is aware.
Okay, thank you.
Hi, it's Patty from Rogers TV. I want to go back to the vaccinations. I was looking at Brant compared to the rest of the province, and we're sort of in the bottom 10 in terms of vaccination coverage compared to the rest of Ontario and other public health units. Is there anything else we can do at this point to get people to get vaccinated?
At this point, we're making our clinics as accessible as we can. We still have a number of things planned in the upcoming weeks, so we're going to be continuing to go to workplaces, to have pop-up clinics. We're going to be continuing at the mall because we are getting a fair bit of traffic there. We are going to be attending more workplaces and schools, so we anticipate we are going to be continuing to see an increase in our numbers.
And you mentioned 4% jump in that 12 to 17 group. Is that in first doses or was that second doses?
That was first doses. So we came up to 76% in first doses, and we're at 65% in second doses. And we are seeing that come up now as those students become eligible for their second doses.
And I'm wondering, too, with schools being back, what Dr. Comley's thoughts are in terms of how things are going with schools here and keeping COVID cases down.
I think when we look where our indicators currently sit right now, it's not surprising that we've seen some cases in schools. We were seeing more community cases, so by proxy we're going to see some more cases in schools. What has been comforting so far is we have not had any outbreaks in schools. So all the cases in schools have been traced to a household contact. I think there's going to be cases in schools. We just have to ensure that we continue the mitigation efforts that are already in place, including masking and distancing, that can help to prevent outbreaks in those schools themselves.
And we mentioned today that there were 2 more deaths reported, and I know the third death that was reported in the last 7 days was someone in their 60s, a woman that had been hospitalized. Is there any information about the 2 recent deaths that were reported today?
I could give you some information there. There was one gentleman in his 60s, which was a suspected community spread, and a second woman in her 30s was also community spread.
Were they hospitalized at the time of death?
They were not classified as hospitalized at time of death, no. Neither of them.
Okay. Thank you. That's it for me.